Hello everyone, welcome to CAPSA. Today's topic is Pheochromocytoma. So, what is Pheochromocytoma? It is a tumor of the chromaffin tissue of the adrenal medulla part which secretes an excessive amount of catecholamines. What are catecholamines? These are epinephrine and non-epinephrine. Coming to the next, how it looks like. It looks like this. This is the kidney part. In the suprarenal part, adrenal gland is present. This is the medulla part. This is the cortex part. Tumor of chromaffin tissue cells happen in the medulla part. Okay. Coming to the next. Who coined the term and who discovered the term pheochromocytoma? Okay. So, pheochromocytoma actually discovered by Frankel in 1886, but the name was coined by P. Why the name like pheochromocytoma? Pheo means dusky or dark. Chromo means the color, and cytoma means tumor cells. So, pheochromocytoma means the dusky colored tumor cells. Now, what are the clinical features of pheochromocytoma? It shows the anxiety, headache, sweating, palpitations, tremor, and orthostatic hypotension. We need to know what do you mean by orthostatic hypotension. It is a form of low blood pressure that happens when standing up from sitting or lying down. Now, what is the diagnosis? For instrumental diagnosis, CT scan and MRI shows the presence of tumor. With this, random urine assay for 24 hours should be continued. Okay, why we need to take the random sample? Because catecholamine shows the shorter half-life. We should keep it in mind. Okay. Now coming to the next. Wait a minute. Okay. What is the treatment? For benign stage, medication is preferable like phentolamine and phenoxybenzamine. But for the malignant stage, surgery is best, but continuous medication should be done before the surgery. Okay. So these medicines comes under alpha what? Alpha receptor what? Antagonist. Okay. Antagonist. We know the alpha receptors are alpha 1 and alpha 2. Okay. Phentolamine, always keep in mind, shows the shorter action given in IV. Okay. But phenoxybenzamine always shows longer action and used oral or IV. Okay. Phentolamine mainly used during the surgery, but phenoxybenzamine mainly used for the preparatory stage. Okay. So these are the medicines mainly used. Thank you.